Hey everybody. So this week my topic is meningitis, and I want to wish everyone a happy last week of recording these lectures. Woo! Okay. So what is meningitis? It's an inflammation of the fluid and three membranes surrounding the brain and the spinal cord. So basically it's swelling within the central nervous system, and it can affect the entire body, and it can also cause long-term effects. It can be contagious, not always, but it can be, and transmitted by coughing, sneezing, close contact. So there are several signs and symptoms for meningitis. They include sudden high fever, stiff neck, severe headache that seems different from normal, headache with nausea or vomiting, confusion or difficulty concentrating, seizures, sleepiness or difficulty waking, sensitivity to light, loss of appetite and thirst, and a skin rash. So some statistics, there is over 1.2 million cases of bacterial meningitis estimated to occur worldwide each year. And without treatment, case fatality rates can be as high as 70%. And then 1 in 5 survivors of the bacterial meningitis can be left with severe permanent complications, such as hearing loss, neurological disability, loss of limb. So these really high case fatality rates are going to be seen in, less developed countries. The country with the highest fatality rate for meningitis is a country in Africa. I forget which one specifically. But those countries where the people are more susceptible to getting diseases are the ones that don't have access to treatment and have the higher percentage of fatality likelihood. So the etiology and pathology, it depends on which type of meningitis. So I'm going to go through all the different types and kind of give like a really brief description of them, kind of what causes each type. So the most common meningitis is caused by viral infections. This is what we're most often going to see. The second most common is bacterial meningitis, which is when bacteria enters the bloodstream and travels to the brain and the spinal cord, which causes acute bacterial meningitis. There's different strains of bacterial meningitis. They all differ in severity. You can read them because they are a lot of hard scientific words, which I know I'll mess up. So all of them right here. And then we have viral meningitis. Most of these cases are caused by enteroviruses, but they can also be caused by herpes simplex virus, the HIV, mumps virus, West Nile virus. And then we have chronic meningitis, which is caused by slow-growing organisms that invade the membrane and fluid surrounding the brain. Then we have viral meningitis, which is contracted by breathing in fungal spores that can be found in soil, decaying wood, or bird droppings. We have parasitic meningitis, which is caused by parasites and tapeworms infecting the brain or cerebral malaria. And then there are some non-infectious causes of meningitis that include chemical reactions, drug allergies, cancer, and inflammatory diseases. I hope you guys can hear this. I didn't check my microphone before. Okay, so some risk factors of meningitis. The biggest risk factor is skipping the vaccine. This is something that the vast majority of infants in America get. This is kind of like just one of our very standard normal vaccinations that we get when we're young. The patient's age can be a risk factor. Most cases of bacterial meningitis occur in children younger than 5. And then living settings can have an effect on the person's likelihood to contract meningitis. Specifically, they are more likely to contract it if living in a community setting, which would include a college dormitory, a military base, a boarding school, or child care facilities. Pregnancy is a risk factor, and compromised immune systems are risk factors. And then to diagnose this, the doctor's going to look at a case history, perform a physical examination, and then through that, they will be looking for if the patient has a fever, if the patient has any skin issues, because a lot of the different types of meningitis, what's the word? Like they appear in the form of rashes. Your doctor's also going to look for an increased heart rate, neck stiffness. Like I said, neck stiffness is one of the most common symptoms, and reduced consciousness. And then some tests the test that that is most often used to diagnose meningitis is a spinal tap, because this analyzes the cerebral spinal fluid. And through this test, the doctors are able to look at white blood count cell, which can indicate if there's an infection, virus within the bloodstream, which could be indicative of meningitis. But there are some other tests that can be done kind of to confirm or like confirm that it is or that it's not meningitis. These include blood cultures, blood count tests, chest x-rays, and CT scans. And so treatment and management, just like etiology and pathology, is dependent on the type of meningitis. So the first type, bacterial meningitis, requires immediate hospitalization. This is what causes the most fatalities, or this is like the number one fatal form of meningitis. And so the likelihood of this becoming fatal in the patient is most likely to occur if the patient has bacterial meningitis. So hospitalization immediately is super important. And then once hospitalized, doctors will treat the patient with intravenous antibiotics and steroids to fight off that bacterial infection. And then fungal meningitis is treated with antifungal agents. Parasitic meningitis is treated with antibiotics. Parasitic meningitis, sometimes they will let it go, but because sometimes the patient can recover from the parasite on their own, like their body can fight it off. But if not, the doctors will go in with antibiotics. It's the same with viral meningitis. Sometimes it's like a waiting game to see if the patient will fight it off on their own. If not, intravenous antiviral medications are recommended. And then chronic meningitis. So this one more is focusing on treating the symptoms. Or no, I'm sorry, that's for viral meningitis is more focused on treating the symptoms and seeing if the patient finds relief without an antiviral medication. But if not, the antiviral medication will be implemented. But sorry, chronic meningitis is when the doctor will go in and treat the core of the problem. So they are either going to treat the fungal infection or the autoimmune issue. And then some complications that can come along with meningitis include hearing loss, which is how we come in. And I'm going to talk a little bit more in depth about that in the next slide. Other complications include memory difficulty, learning disabilities, brain damage, gait problems, seizures, kidney failure, shock, and death. So the effect on the hearing, obviously swelling in the brain is going to interfere with our senses. It can cause the patient to have tinnitus. Oh, excuse me. Sorry. Yeah, so it can cause symptoms such as tinnitus, partial hearing loss, or deafness, which in effect can cause speech problems. 5 to 35% of patients with bacterial meningitis will develop permanent sensory hearing loss, sensory neural hearing loss, which I thought was kind of like really crazy. And then profound hearing loss could occur in up to 4% of patients with bacterial meningitis. But early rehabilitation will lessen the long-term educational and social difficulties of these patients, specifically children who are still in school, still in social settings at a young age. Their language hasn't fully developed all the way. Rehabilitation is really important to lessen those difficulties that the children are experiencing. And then here are my references for this week. I hope you guys have a great week. I hope you have a great rest of your semester. And I think we're going to meet up soon for our final study session. So I'll see you guys all then. Right, bye.